Pandemic's legacy is already clear. All of this will happen again. By Ed Yong. September 30th, 2022, 7 a.m. Eastern Standard Time. Recently, after a week in which 2,789 Americans died of COVID-19, President Joe Biden proclaimed that the pandemic is over. Anthony Fauci, why it is, y'all. This is DaamnKam coming at you with what were the biggest headlines of 2022, and topping that list according to the Apple Spotlight is an article by Ed Yong. The pandemic's legacy is already clear. All of this will happen again. Ed Yong writes with The Atlantic. This was published September 30th, 2022 at 7 a.m. Eastern Standard Time. Recently, after a week in which 2,789 Americans died of COVID-19, President Joe Biden proclaimed that the pandemic is over. Anthony Fauci described the controversy around this proclamation as a matter of semantics, but the facts we are living with can speak for themselves. COVID still kills roughly as many Americans every week as died on 9/11. It is on track to kill at least 100,000 a year, triple the typical toll of the flu. Despite gross undercounting, more than 50,000 infections are being recorded every day. The CDC estimates that 19 million adults have long COVID. Things have undoubtedly improved since the peak of the crisis, but calling the pandemic over is like calling a fight finished because your opponent is punching you in the ribs instead of the face. American leaders and pundits have been trying to call an end to the pandemic since its beginning, only to be faced with new surges or variants. This mindset not only compromises the nation's ability to manage COVID, but also leaves it vulnerable to other outbreaks. Future pandemics aren't hypothetical, they're inevitable and imminent. New infectious diseases have regularly emerged throughout recent decades, and climate change is quickening the pace of such events. As rising temperatures force animals to relocate, species that have never coexisted will meet, allowing the viruses within them to find new hosts, humans included. Dealing with all this again is a matter of when, not if. In 2018, I wrote an article in The Atlantic warning that the U.S. was not prepared for a pandemic. That diagnosis remains unchanged. If anything, I was too optimistic. America was ranked as the world's most prepared country in 2019 and bafflingly again in 2021. But accounts for 16% of global COVID deaths, despite having just 4% of the global population. It spends more on medical care than any other wealthy country, but its hospitals were nonetheless overwhelmed. It helped create vaccines in record time, but is 67th in the world in full vaccinations. This trend cannot solely be attributed to the political division. Even the most heavily vaccinated blue state, Rhode Island, still lags behind 21 nations. America experienced the largest life expectancy decline of any wealthy country in 2020, and unlike its peers, continued declining in 2021. If it had fared as well as just the average peer nation, 1.1 million people who died last year, a third of all American deaths, would still be alive. America's superlatively poor performance cannot solely be blamed on either the Trump or Biden administrations, although both have made egregious errors. Rather, the new coronavirus exploited the country's many failing systems. Its overstuffed prisons and understaffed nursing homes, its chronically underfunded public health systems, its reliance on convoluted supply chains than a just-in-time economy, its for-profit healthcare system whose workers were already burned out, its decades-long project of unweaving social safety nets, and its legacy of racism and segregation that had already left Black and Indigenous communities and other communities of color disproportionately burdened with health problems. Even in the pre-COVID years, the U.S. was still losing 626,000 people, more than expected for a nation of its size and resources. COVID simply toppled an edifice whose foundations were already rotten. In furiously racing to rebuild on the same foundation, Americans set up themselves to collapse once more. Experience is reputedly the best teacher, and yet the U.S. repeatedly mistakes from early pandemic. When faced with the Delta and Omicron variants, it got early global access to vaccines and nonetheless lost almost 500,000 people after all adults became eligible for the shots. It has struggled to control monkeypox, a slower spreading virus for which there's already a vaccine. Its right-wing legislators had passed laws and rulings that curtailed the possibility of important public health measures like quarantines and vaccine mandates. It had made none of the broad changes that would protect its population against future pathogens, such as better ventilation, universal paid sick leave. Its choices virtually guarantee that everything that's happened in the past 3 years will happen again. The U.S. will continue to struggle against infectious diseases in part because its deeply held values and theoretical to the task of besting a virus. Since its founding, the country has prized a strain of rugged individualism that prioritizes individual freedom and valorizes self-reliance. According to this ethos, people are responsible for their own well-being. Physical and moral strength are equated. Social vulnerability results from personal weakness rather than policy failure. And handouts or advice from the government are unwelcome. Such ideals are disastrous when handling a pandemic for two major reasons. First, diseases spread. Each person's choice inextricably affect their community, and the threat to the collective always exceeds that to the individual. The original Omicron variant, for example, posed slightly less risk to each infected person than the variants that preceded it, but spread so quickly that it inundated hospitals, greatly magnifying COVID's social costs. To handle such threats, collective action is necessary. Governments need policies such as vaccine requirements or, yes, mask mandates that protect the health of entire populations, while individuals have to consider their contribution to everyone else's risk alongside their own personal stakes. And yet, since the spring of 2021, pundits have mocked people who continue to think this way for being irrational and overcautious, and government officials have consistently framed COVID as a matter of personal responsibility. We're going to pause this article right here from Ed Yong. This is DaamnKam with Daam Talk. There is so much twisting of opinions inserted into this dialogue that it was difficult not to stumble over the words as they came out of my mouth. For example, claiming that the presidency and the cabinet was more pushing personal responsibility when it came to COVID is an absolute falsehood. The fact that Joe Biden came out and required workers to either get the vaccine or show a negative test once a week was tantamount to forced vaccinations. Many people say, well, they didn't have to get the vaccine. Well, that's right. They would only lose their job if they didn't. That is not a choice. Secondly, the numbers from the CDC when it comes to death tolls for COVID in 2020 and 2021 were proven to be exaggerated. They were putting deaths into the COVID category that would otherwise have been marked as an automobile accident or a death of old age, but individuals who died from other ailments that also had COVID at the time of death were counted as COVID deaths. This was going on all over the nation. Many nurses and doctors were speaking out about this ridiculous policy. The vaccinations of which we are now prescribing all of America, the ones that this Ed Yong has said only 60% of eligible Americans have obtained, is the very same vaccine that has now been proven to increase cardiac arrest rates in young adults. The same vaccine that killed a 9-year-old boy 2 days after getting the vaccine. Now, that's not a rare story. This is one that we knew personally. This was our old doctor's best friend's son. What this means for Apple putting this article in the spotlight is yet to be seen. We will read on. We continue. First, diseases spread. Each person's choices inextricably affect their community, and the threat to the collective always exceeds that to the individual. This was what we had already read. Apologies. Second, a person's circumstances always constrain their choices. Low-income and minority groups find it harder to avoid infections or isolate when sick because they're more likely to live in crowded homes and hold hourly wage jobs without paid leave or the option to work remotely. Places such as prisons and nursing homes, whose residents have little autonomy, became hotspots for the worst outbreaks. Treating a pandemic as an individualist free-for-all ignores how difficult it is for many Americans to protect themselves. It also leaves people with vulnerabilities that last across successive pathogens. The group that suffered most during the H1N1 influenza pandemic of 2009 were the same ones that took the brunt of COVID a decade later. America's individualist bent has also shaped its entire healthcare system, which ties health to wealth and employment. Finally, something we can agree on. This is DaamnKam again. We 100% back that the America's individualist bent has also shaped its entire healthcare system, which ties health to wealth and employment. We were so on board for a 2016 Bernie Sanders Medicare for all. We were so on board for a 2020 Bernie Sanders college debt wiped out. Free healthcare for citizens, tax-paying, American-blooded citizens. However, the COVID crisis, amongst other things, was enough to really shed light on the broken legalities of our system and also caused us at DaamnTalk to step back, reassess our faith in the government, and decide that maybe a privatized health insurance all across the board for everybody wouldn't actually be such a good thing. Maybe, just maybe, the government isn't actually competent enough to provide such a service. And we continue. That system is organized around treating sick people at great and wasteful expense, instead of preventing communities from falling sick in the first place. The latter is the remnant of public health rather than medicine, and has long been underfunded and undervalued. Even the CDC, the nation's top public health agency, changed its guidelines in February to prioritize hospitalizations over cases, implicitly tolerating infections as long as hospitals are stable. But such a strategy practically ensures the emergency rooms will be overwhelmed by a fast-spreading virus, that consequently healthcare workers will quit, and that waves of chronically ill long haulers who are disabled by their infections will seek care and receive nothing. All of that has happened and will happen again. America's pandemic individualism means that it's your job to protect yourself from infection. If you get sick, your treatment may be unaffordable. And if you don't get better, you will struggle to find help or even anyone who believes you. In the late 19th century, many scholars realized that epidemics were social problems whose spread and toll are influenced by poverty, inequality, overcrowding, hazardous working conditions, poor sanitation, and political negligence. But after the advent of germ theory, this social model was displaced by a biomedical and militaristic one, in which diseases were simple battles between hosts and pathogens, playing out with individual bodies. The paradigm conveniently allowed people to ignore the social context of disease. Instead of tackling intraceable social problems, scientists focused on fighting microscopic enemies with drugs, vaccines, and other products of scientific research, an approach that sat easily with Americans' abiding fixation on technology as a panacea. The allure of biomedical panaceas is still strong. For more than a year, the Biden administration and its advisors have reassured Americans that with vaccines and antivirals, we have the tools to control the pandemic. These tools are indeed effective, but their efficiency is limited if people can't access them or don't want to, and if the government doesn't create policies that shift that dynamic. A profoundly unequal society was always going to struggle with access. People with low incomes, food insecurity, eviction risk, and no health insurance struggled to make or attend vaccine appointments even after shots were widely available. A profoundly mistrustful society was always going to struggle with hesitancy made worse by political polarization and rampantly spreading misinformation. The result is that just 72% of Americans have completed their initial course of shots, and just half have gotten the first of the boosters necessary to protect against current variants. At the same time, almost all other protections have been stripped away, and COVID funding is evaporating. And yet the White House's recent pandemic preparedness strategy still focuses heavily on biomedical magic bullets, paying scant attention to the social conditions that could turn those bullets into duds. Technological solutions also tend to rise into society's penthouses, while epidemics seep into its cracks. Cures, vaccines, and diagnostic tools first go to the people with power, wealth, and education, who then move on, leaving the communities most affected by diseases to continue shouldering their burden. This dynamic explains why the same health inequities linger across the decades, even as pathogens come and go, and why the U.S. has now normalized an appalling level of COVID death and disability. Such suffering is concentrated among elderly, immune-compromised, working class, and minority communities, groups that are underrepresented among political decision-makers and the media, who get to declare the pandemic over. Even when inequities are highlighted, knowledge seems to suppress action. In one study, white Americans felt less empathy for vulnerable communities and were less supportive of safety precautions after learning about COVID's racial disparities. I'm going to pause again right here. What in the actual is Ed Yong talking about? In one study, white Americans felt less empathy for vulnerable communities and were less supportive of safety precautions after learning about COVID's racial disparities. We are going to call out Ed Yong personally. This is some incentivized race-based division. At the very least, this is incentivized race-based division. What white groups? What studies? I don't see a cite here, a citation. Are we talking about English American groups? Are we talking about German groups? Are we talking about Europeans? Who are we talking about, and what minorities? Because last time we checked, we are in a minority now. Straight white males are becoming the minorities. Able-bodied, hard-working straight white males, nevertheless. And we will continue to our detriment. This attitude is self-destructive and limits the advantage that even the most privileged Americans enjoy. Measures that would flatten social inequities, such as universal health care and better ventilation, would benefit everyone, and their absence harms everyone too. In 2021, young white Americans died at lower rates than black and indigenous Americans, but still at 3 times the rate of their counterparts in other wealthy countries. One more time, because we have to make it about race. In 2021, young white Americans died at lower rates than black and indigenous Americans, but still at 3 times the rate of their counterparts in other wealthy countries. That's called side speak. Mr. Young, you are insinuating that young white Americans have less risk for COVID, have less risk of complications for being hospitalized for COVID, but then throwing in at the end that they're still 3 times more likely to get sick than in other wealthy countries. And we continue. By failing to address its social weaknesses, the U.S. accumulates more of them. An estimated 9 million Americans have lost close loved ones to COVID. About 10% will likely experience prolonged grief, which the country's meager mental health services will struggle to address. Because of brain fog, fatigue, and other debilitating symptoms, long COVID is keeping the equivalent of 2 million to 4 million Americans out of work. Between lost earnings and increased medical costs, it could cost the economy $2.5 $2.6 trillion a year. The exodus of healthcare workers, especially experienced veterans, has left hospitals with a shortfall of staff and know-how. Levels of trust, one of the most important predictors of a country's success at controlling COVID, have fallen, making pandemic interventions harder to deploy, while creating fertile ground in which misinformation can germinate. This is the cost of accepting the unacceptable, an even weaker foundation that the next disease will assail. Mr. Yang then goes on to wrap his article up by saying, and we quote, "In the spring of 2020, I wrote that the pandemic would last 4 years and that the U.S. would need long-term strategies to control it. But American leaders consistently acted as if they were fighting a skirmish rather than a siege, lifting protective measures too early and then reenacting them too slowly. They've skirted all the responsibility of articulating what it would actually look like for the pandemic to be over, which has meant that whenever citizens managed to flatten the curve, the time they bought was wasted. Endemicity was equated with inaction, rather than active management. This attitude removed any incentive or will to make the sort of long-term changes that would curtail the current disaster and prevent future ones. And so America has little chance of effectively continuing the inevitable pandemics of the future. America has little chance of effectively countering the inevitable pandemics of the future. Will they be continued? Well, we shall find out. And we continue. It cannot even focus on the one that's going on right now. If change happens, it will likely occur slowly and from the ground up. In the vein of ACT UP, the extraordinary successful activist group that changed the world's approach to AIDS. Grassroots organizations of long haulers, grievers, immune-compromised people, and other disproportionately harmed by the pandemic have formed, creating the kind of vocal continuity that public health has long lacked. More pandemics will happen, and the U.S. has spectacularly failed to contain the current one, but it cannot afford the luxury of nihilism. It still has time to address its bedrocks of individualism and inequality, to create a healthcare system that effectively prevents sickness instead of merely struggling to treat it, and to enact policies that rightfully prioritize the needs of disabled and vulnerable communities. Such changes seem unrealistic, given the relentless disproportions of the past 3 years, but substantial social progress always seems unfeasible until it's actually achieved. Normal led to this. It is not too late to fashion a better normal." Ed Young is a staff writer at The Atlantic. He won the Pulitzer Prize for explanatory reporting for his coverage of the COVID-19 pandemic. End article. Well, we believe everything that was needed to be reiterated was done very clearly in this last paragraph. For in putting equity over equality, for putting security over freedom, for putting collectivism before individualism, which is really what this entire article was advocating for. Drop the individualistic view where it's a free, sovereign society, one that does not dictate whether or not I have to cover my face when walking in public, one that does not get to determine whether or not we stick chemicals into our bodies or our children's bodies. We are sovereign individuals. This is a free, democratic republic. If we prioritize minorities or any sort of groups of people above other groups of people, we are asking for trouble. We have equality in this country. We give opportunity based on equality, not based on equity. Quote, it cannot afford the luxury of nihilism, end quote. Nihilism, you mean when a country orders its citizens to inject themselves with a vaccine that was produced in a record time? You mean to force workers to comply with vaccine mandates? We don't believe that's nihilism. The complications that are occurring because of these vaccines on a daily basis, not just for, quote, young white Americans or, quote, disproportionately affected minorities, end quote. I'm all for staying safe, but I'm all for staying free. I would wear a mask if I go out into the grocery store. I would put my mask on because it was required of me. The second I walk outside that door, I took that mask off. I went in some businesses that did not require masks. You know what? I didn't wear my mask in that business. I went into cities that required masks outside, walking on public sidewalks. You know what? I did not wear my mask. I go over to my elderly friend's house. I'm going to wear my mask. I'm not going to go get an experimental vaccine. Those who sacrifice freedom for security deserve neither. We need to take a long, hard look at what it is we really value. We value our neighbors. We value our neighbors' lives. But we value our own family and our own freedom and our own rights. And that is something that used to be glorified, used to be looked up to. It used to be a proud occupation to be a patriot of the United States of America. And we don't pledge the allegiance anymore. God bless America. Stay free. Happy 2023. Look after you and your family. Do your own research. The revolution will not be televised. Check out Damn Talk. I'm going to be sitting down talking with folks, producing some interesting, high-quality interviews, different sorts of content that'll be coming about halfway through this year. And the rest of it, straight from the dome piece. Mr. Nurmak Black and yours truly, DaamnKam, DaamnTalk, Damn Talk, where people precede information.